Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 10th lecture on systemic pathology. Today, day 4 of colorectal diseases. Today's topic is colorectal carcinoma. Day 4 of colorectal diseases. Today's topic is colorectal carcinoma. Dear audience, you know carcinoma is the malignant tumor that arises from epithelial cell or epithelial tissue. Carcinoma is the commonest malignant tumor of colon. Carcinoma is the commonest malignant tumor of colon. About 98% malignancies of colon is carcinoma. Carcinoma is the commonest malignant tumor of colon. About 98% malignancies of colon is carcinoma. Incidence of colorectal carcinoma. Incidence of colorectal carcinoma is next to lung cancer. So the incidence of colorectal carcinoma is next to lung cancer. Dear audience, now come to the predisposing factors of colorectal carcinoma. Predisposing factors of colorectal carcinoma is sex, pre-existing diseases of colon, dietary factors, genetic factors. Dear audience, age, sex, pre-existing disease of colon, dietary factors, genetic factors are associated with colorectal carcinoma. Age. Colorectal carcinoma is common around 7th decade of life. Common around 7th decade of life. Sex. Colorectal carcinoma occurs in both sexes, but it is common in female. Common in female. Pre-existing diseases of colon. Diseases of colon. Dear audience, you know ulcerative colitis is an ulcero-inflammatory bowel disease that principally occurs in rectum and left colon, and it is a pre-malignant condition of the colon. So ulcerative colitis is one of the pre-existing disease of colon that may lead to colorectal carcinoma. So one is ulcerative colitis. Dear audience, you know there are three types of adenoma in the colon: tubular adenoma, tubulovillous adenoma, and villous adenoma. You know villous adenoma is one of the pre-malignant conditions of the colon. So villous adenoma is pre-existing disease of colon that may turn to colorectal carcinoma. Villous adenoma. Villous adenoma of colon. Dietary factors. Low intake of unabsorbable vegetable fiber. High intake of refined carbohydrate. Refined carbohydrate. High intake of animal fat. Animal fat. Dear audience, among the dietary factors, low intake of unabsorbable vegetable fiber, high intake of refined carbohydrate, high intake of animal fat. These are associated with colorectal carcinoma. Respected audience, now come to pathogenesis of colorectal carcinoma. It has been suggested that low intake of unabsorbable vegetable fiber, with high intake of refined carbohydrate, like sugar, low intake of unabsorbable vegetable fiber with high intake of refined carbohydrate like sugar, reduction of bulk of stool in colon. Dear audience, as there is low intake of unabsorbable vegetable fiber with high intake of refined carbohydrate like sugar, there will be reduction of bulk of stool in the colon. Dear audience, as there is reduction of bulk of stool in colon, there will be delayed defecation reflex. Delayed defecation reflex. Dear audience, suppose this is the colon. If this is the rectum, as there is low intake of unabsorbable vegetable fiber with high intake of refined carbohydrate, reduction of bulk of stool in the colon. So suppose this is the bulk of stool and it is reduced in amount. Due to reduction of bulk of stool in the colon, there will be delayed defecation reflex. As there is delayed defecation reflex, stool remain in contact of the colonic mucosa for a long time. Stool remain for a long time with colonic mucosa. So, if this is the colonic mucosa, the stool remain for a long time with the colonic mucosa. High intake of animal fat, bile salt, comes in colon from gallbladder, remain for a long time with the stool. Dear audience, as stool remain for a long time in the colon due to delayed defecation reflex, following high intake of animal fat, bile salt that comes from the gallbladder remain for a long time along with the stool. As bile salt remains for a long time along with the stool, the normal flora of the colon undergo alteration. As bile salt remain for a long time along with stool, normal bacterial flora undergo alteration. These altered bacterial flora get enough time to break the bile salt. The altered bacterial flora get enough time to break the bile salt, as there is delayed defecation reflex. Again, as there is delayed defecation reflex, the altered bacterial flora get enough time to break the bile salt. Bile salt is broken by altered bacteria into carcinogen, and this carcinogen may initiate carcinogenesis or may promote carcinogenesis or may potentiate carcinogenesis. This carcinogen may initiate carcinogenesis or may promotes carcinogenesis or may potentiate carcinogenesis. Potentiate carcinogenesis. Again, dear audience, low intake of unabsorbable vegetable fiber with high intake of refined carbohydrate like sugar, there will be reduction of bulk of stool. Due to reduction of bulk of stool, there will be delayed defecation reflex and stool remain for long time in contact with the colonic mucosa. High intake of animal fat, bile salt comes from the gallbladder. Due to delayed defecation reflex, bile salt remain for long time along with the stool. Due to long time stay of bile salt, the colonic normal flora undergo alteration, and this altered colonic normal flora breaks the bile salt into carcinogens, and this carcinogen may initiate carcinogenesis or may promote carcinogenesis or may potentiate carcinogenesis. Dear audience, besides this, there is butyric acid, and this butyric acid is derived from the unabsorbable vegetable, and this butyric acid is associated with normal metabolism of colonic mucosa. Besides this, butyric acid, a short chain fatty acid derived from unabsorbable vegetable. This butyric acid is associated with normal metabolism of colonic mucosa. Associated with normal metabolism of colonic mucosa. Low intake of unabsorbable vegetable, there will be reduction of butyric acid. Low intake of vegetable, reduction of butyric acid. As there is reduction of butyric acid, there will be disturbance in the metabolism of colonic mucosa. Disturbance of metabolism of colonic mucosa. As there is disturbance of metabolism of colonic mucosa, there will be signs of carcinogenesis. Signs of carcinogenesis. So, this is the pathogenesis of carcinogenesis in the colon. Now come to morphology of colorectal carcinoma. Gross examination reveals common site is rectum. Carcinoma that occurs in the right colon, it is usually protruding and polypoid in nature. Carcinoma in right colon is protruding and polypoid. If this is the right colon, the carcinoma is protruding like polypoid. The carcinoma in left colon is encircling the colonic wall and causes obstruction. Carcinoma in left colon encircles the colonic wall and produces obstruction. Carcinoma in left colon encircles the colonic wall and produces obstruction. If this is the left colon, the carcinoma occurs encircling the colonic wall and it produces the obstruction. The surface of the colorectal carcinoma may be fungating. Surface of colorectal carcinoma may be fungating. These are the morphology of colorectal carcinoma on gross examination. Dear audience, now come to histopathology of colorectal carcinoma. Histopathology reveals anaplastic cells arranged as glands invading the stroma. Large and hyperchromatic nucleus, anaplastic cells show glandular differentiation. The anaplastic cells arranged as glands. This is the histopathology of colorectal carcinoma. Dear audience, these are the stroma, anaplastic cells arranged as glands invading the stroma. Now come to laboratory diagnosis of colorectal carcinoma. For diagnosis of colorectal carcinoma, we can do local blood test of stool. Local blood test of stool. Dear audience, if anybody suffers from colorectal carcinoma, local blood test is positive. Ultrasonography, CT scan, colonoscopic biopsy and histopathology. Colonoscopic biopsy and histopathology. Tumor marker. Like carcinoembryonic antigen. So these are the different investigations we can perform to diagnose a case of colorectal carcinoma. Dear audience, today I have told you about the colorectal carcinoma briefly. Carcinoma is a malignant tumor of epithelial cellular tissue. Carcinoma of colon is the commonest malignant tumor of colon. It is about 98% of colonic malignancies. Age of occurrence of colorectal carcinoma usually around 7 decades of life. Female sufferer more than the male. Pre-existing diseases like ulcerative colitis, villus adenoma is associated with the colorectal carcinoma. There is genetic factors for colorectal carcinoma. There are some dietary factors for colorectal carcinoma. Low intake of unabsorbable vegetable fiber, high intake of refined carbohydrate, high intake of animal fat is associated with the colorectal carcinoma. It has been suggested that low intake of unabsorbable vegetable fiber with high intake of refined carbohydrate like sugar, there will be reduction of bulk of stool. Due to reduction of bulk of stool, there will be delayed defecation reflex. So stool will remain for a long time along with the mucus of the colon. High intake of animal fat, bile salt comes from the gallbladder, remain along with the stool for a long time due to delayed defecation reflex. Due to long time stay of bile salt along with the stool, there is alteration of the normal bacterial flora of the colon. This altered bacterial flora get enough time to break the bile salt into carcinogen. There is production of carcinogens. These carcinogens may initiate carcinogenesis or may promote carcinogenesis or potentiate the carcinogenesis. Besides this, there is butyric acid, a short chain fatty acid. It is derived from the unabsorbable vegetable, and this butyric acid is associated with the normal metabolism of the colonic mucosa. Due to low intake of unabsorbable vegetable, there will be reduction of butyric acid. As reduction of butyric acid, disturbance of colonic mucosal metabolism, so there is chance of carcinogenesis. Morphology of the colorectal carcinoma usually occurs in colon. In the right colon, it is polypoid mass. In the left colon, it encircles the wall of the colon and produces obstruction. the surface of the colorectal carcinoma may be fungating. Histopathology reveals anaplastic cells arranged as glands invading the stroma. Laboratory diagnosis of colorectal carcinoma, focal blood test, it is usually positive. Ultrasonography, CT scanning, colonoscopic biopsy and histopathology, tumor marker like carcinoembryonic antigen. The titer of carcinoembryonic antigen will be high. Dear audience, this is all about the colorectal carcinoma. Briefly, today up to this, thanks all.